Hello, I'm Eileen, Vogel's menopause expert, and welcome to another YouTube live chat on the menopause. And today we're going to be talking about those embarrassing menopause problems. Now, we know that symptoms such as hot flushes and night sweats are really common, but there's many other symptoms that can be quite embarrassing for us to deal with, such as vaginal dryness, bladder incontinence, weight problems, memory loss, loss of libido, breast tenderness, sore nipples, and many, many more. Now, we did a little survey on my menopause Facebook page, and 46% of women were put off going to the doctor because they felt they were too embarrassed to talk about their symptoms. And 86% of women in this situation prefer to find their own solutions rather than going and speaking to their doctor. And 87% of those women felt that these embarrassing symptoms were impacting on their self-confidence and how they feel about themselves. Now, it is difficult, especially in the UK, to go to your doctor. Very often you have to wait for a long time for an appointment. You may be part of a big practice where it's very difficult to see the doctor all the time, so you don't end up having a nice relationship with them, and they don't know you. It may well be there's very young male doctors in the practice, and you know, let's face it, do we really want to be talking about our most intimate problems with someone who seems very, very young? Often what happens as well is sometimes just sitting down and being able to voice how we feel can make us start to cry. And unfortunately then you don't get to explain how you really feel, and very often you're offered things like antidepressants. Another thing we find is you tend to get very short doctor's appointments. And I know from personal experience, when women call me on the phone, 10 minutes isn't nearly enough to try and get to grips with what's going on. However, all that being said, it is really important to get your symptoms checked out by your doctor one way or another. The reason being is very often there could be underlying issues. Now, symptoms such as low thyroid function, low iron, low vitamin D, low vitamin B12, or even hormonally induced diabetes can cause many symptoms that look exactly like menopause ones. And it sometimes can be really difficult to distinguish between the two, and therefore it can be very difficult to treat. What we've done is we've formulated a little handy checklist that you can download. There'll be a link here that you can take to your doctors. It's about ticking symptoms off under the headings such as thyroid or low vitamin D, and that can help to maybe give your doctor a little bit of a better idea of how you are feeling without you having to go into absolutely everything. The other thing to do is, if you do feel that you're going to be intimidated by your doctor, or you feel that you're just not in an emotional state to explain everything, write everything down that you want to discuss and take that with you. Take along a friend or a female relative who can support you. So if you do feel overwhelmed, if you feel like you're going to cry, then there is going to be someone else just to help you through that, so that you can explain how you feel. The other really important thing here is, if you don't feel satisfied with the information that you have got, ask plenty of questions. You will be totally surprised the number of women who go to the doctor and get prescribed HRT or medication, and then they come to us to ask all about it because either they forgot to ask or the doctor didn't explain. So ask as many questions as you can, and the more you know, the more likely you'll be satisfied at the end of the appointment. Now, please start posting your questions, and for those of you that are watching on replay, you can post a question in the comment section and I will be happy to answer it during the week. Before I start though, I thought I would just talk about one or two embarrassing problems just so that you can get an idea of the sorts of things that we're happy to help with. Interestingly enough, body odour is one that a lot of women get very concerned about. And again, on our menopause page, 59% of women felt that they were smelling more than normal. Now, two things are likely to happen here. One is, yes, your body odour can change because of all the hormonal changes that are going on. You're also sweating more if you're getting hot flushes or night sweats, so there's going to be far more of that going on too. But the other thing that can happen is that falling estrogen can affect the mucous membranes in the nose, and that can affect our smell. Can happen in two ways. You either find you smell less or you smell things very differently. So maybe you suddenly decide that you hate the perfume you've been wearing for the last 20 years. But the other thing that can happen is it can actually make your sense of smell more acute. So you feel as if you're smelling more and nobody else notices this. What to do about this? A number of things. Drink loads of water, especially if you're getting hot flushes or night sweats, because a lot of it can be due to dehydration. Check your bowels as well, because falling estrogen can cause constipation, and constipation can cause more sweating and more body odour too. And try some of the natural deodorants. If you use antiperspirants, they will block the pores under the arms, which means that you've got to sweat from somewhere else. And sometimes that can make a lot of difference too. Other thing that happened was I sent out a little promo video on Monday just to let everybody know what we were talking about, and two ladies, so hi Beth and hi Lisa, you were talking about the embarrassment of getting hairs on the chin. This is what happens in the menopause. For some of you ladies, you're going to lose hair, which you obviously don't want. So that's another issue we could look at. But for others, you start to get hair in all the places that you don't want, like the chin. We end up getting a nice little bit of moustache stubble too. One of the reasons that this can happen is that as your hormones start to fall, now we're used to thinking about estrogen and progesterone, but we also have a small amount of testosterone, and sometimes that can either rise or it gets stuck, if you like, at its normal level, and your estrogen and progesterone fall. So higher levels of testosterone are more likely to cause body hair in areas where men would normally get it. So for this, if it's a real issue for you, the best thing to do is ask your doctor maybe to see if they'll test your testosterone levels. Very often, if it is high, your hair can also be accompanied, you can get very angry, you can get very aggressive as well. So there can be quite a big mood change here as well. So if these are all lumped together, then maybe just ask the doctor if they can test your testosterone levels, and they might be able to offer you something to help. The only other thing you can really do with this would be to treat yourself maybe to some electrolysis, which I know is an absolute pain here. So let's see if we have any questions. There's Felicity. Hi Felicity. She's saying my memory is getting worse and I keep getting very flustered of work because of it. It's really embarrassing. This is a horrible one because two things can happen. You can literally just freeze on the spot. You can be talking to somebody and your memory can just completely go. You might find you start to forget people's names. I know for me, I was never very good at remembering people's names, but it just got even worse. And that can be awful if you meet in the street and they go, hi, how are you? And you're just thinking, oh, I can't remember their name. You can also get foggy thinking as well. It just means that you can't keep your thoughts together, and you might find that you go off in a little bit of a trance, or you tend to daydream. And I know one of the things that can be a little bit frightening is when you're driving and you seem to completely go somewhere else. Luckily you get to where you're going safely, but you just think, I don't remember that whole part of the journey. So In these situations, again, it's nearly always to do with falling estrogen. You can look at the herb ginkgo biloba. This is traditionally used for focus and memory. Also keep an eye on your water, because if you're getting flushes and sweats and problems with your memory, this can be due to dehydration. If you're at work and it's happening a lot at work, then do a little diary, because you might find that this memory blip is happening at roughly the same time every day. If it is, there's usually a good reason, such as you've had too much caffeine, you've had too many biscuits, you've not had your lunch, you've not had anything to eat, or you haven't been drinking any water. So this can be a nice little tip to get to grips with what's causing these symptoms that are happening at the same time every day. If you're really worried about your memory, and I know so many women have these issues with memory, they start to panic that they're getting Alzheimer's or dementia, and it's not helping if other members of the family are going, have you forgotten that again? So if you're worried about this at all, please do go and just have a little chat with your doctor. Louise is talking, she keeps getting urinary tract infections. Is this common? Unfortunately, this is really common. We do find that a lot of women are getting one urinary tract infection, and then they're getting antibiotics. The antibiotics are dealing with it, but unfortunately, the antibiotics will affect the friendly bacteria in the vagina, and that can also have an impact. The friendly bacteria in your vagina help to police the whole vaginal area, and that also includes the opening to the bladder. So you then end up in the position where your bladder is less protected, and as we go through the menopause, our bladder can get weaker and more prone to infection. So this can end up a real vicious cycle in this situation. You then go back to the doctor, you get more antibiotics. And we've had some women that have been literally on this roundabout for a year. It's horrible. You know, I've had cystitis a couple of times. It's so painful, it's very uncomfortable, you can't focus. So I really can't imagine how bad that would be, getting it on a regular basis. If you want to treat it naturally, the one thing you go for is a vaginal probiotic. You would then look, we have a remedy called uva ursi and echinacea, which is licensed. It's traditionally used to help with bladder infections such as cystitis. And drink loads of water. If you're getting bladder infections and flushes and sweats, you're going to be very dehydrated and your urine is going to be very acidic, and that's going to irritate the bladder and it's going to make all your symptoms worse. So this is one where you know, getting some kind of intervention in between the rounds of antibiotics can be very, very helpful. We can also look at symptoms like vaginal dryness. This is the huge issue here in the menopause. Falling estrogen can affect the way in which the cervix produces mucus in the vagina, and the vaginal mucus is slightly acidic. And again, you know, we're talking about the friendly bacteria here. If the mucus changes in the vagina, then that can lead to vaginal dryness. That can then have a huge impact on just general discomfort. It can be very painful then to have intercourse because you're not producing enough mucus. It can then lead to other infections, and that mucus also protects the vagina wall. So if you're losing mucus, the vagina wall itself can become less elastic, it can become damaged much more easily, and it's amazing how many women find that after intercourse they have a little bleed, and very often it's because the vaginal wall has ended up being irritated or has ended up with a little tear. So it's a horrible situation, because it's not just about vaginal dryness, it can have a huge impact on your relationship and also your sexual activity. So here, definitely vaginal probiotics. Also look at getting something like a sea buckthorn oil. Sea buckthorn oil is called omega-7, and it's a very specific essential fatty acid, and we know during the menopause that lots of our mucous membranes can be affected, and sea buckthorn oil is a lovely one to help with vaginal dryness too. And interestingly enough, for vaginal dryness, 63% of women were too embarrassed about this, and 75% of those didn't actually want to go and see their doctor about it too. We can also look at loss of libido in the menopause. It's a big one. So as well as having vaginal dryness, you can also have loss of libido, and this is going to interfere with your sex life too. It's a difficult one because there can be a whole group of factors involved here. We've got the vaginal dryness. It can also be due to fatigue. It can be due to muscle aches and joint aches and pains as well. And it's just this loss of estrogen can take the oomph out of our life, if you like. And when you add all these together, a lot of women find that their libido just goes completely out the window. You can look at herbs such as maca, you can look at Siberian ginseng, and there's another herb called horny goatweed, which can be used for both men and women. So you could look at these to help, but look at the underlying issues as well. Why are you not feeling like intercourse? Is it because you're too tired? Is it because by the end of the night you've had so much to do that all you want to do is sleep? Is it sleep itself? Are you finding that your sleep is being interrupted by your hot flushes and your sweats? So sometimes with this one you need to look at several different areas in your life just to see if anything else is going on. Ladies, I'm going to have to take a little break for a minute or two. We're having a little bit of a malfunction. Technology is wonderful, but these things do happen. Okay, but what I'm going to do, your questions are not coming through, so no doubt I'm going to end up getting a lot all at once. I'll have a little look, while we're waiting for this, we'll have a little look about bladder incontinence. Unfortunately, these areas all seem to be connected. There's a number of issues with bladder incontinence that can happen here. We have what's called the pelvic girdle muscles, and these are, it's like a sling where the muscles go between the two under ends of our hips. These muscles hold up our bladder, the womb, our uterus, and all the digestive organs that are in this particular area. One of the things that happens as we go through the menopause is that these muscles can weaken, and as they weaken, especially the bladder, the bowel, or the uterus, can slip position. What can happen then, especially with the bladder, is the bladder can get squashed between the bowel and the vagina. When that happens, the whole area, so the amount of urine that your bladder can hold decreases, so it can decrease quite considerably, which means that you then end up having to run to the toilet an awful lot more often than what you did before. The other thing that can happen here is the bladder itself can weaken, and remember I talked about mucous membranes. So the bladder itself, the internal part of the bladder can weaken. The bladder valve can weaken to the point where you can no longer control the bladder. So you then end up getting leakage. It may just happen when you laugh, when you run, when you do your exercises, but it could also happen sometimes spontaneously. And I know that a number of women have, they've got to the point where they're having to wear pads all the time because their bladder is leaking. The problem with this situation too is because you're having to go to the toilet so often, you tend to cut down on what you're drinking. And when that happens, you then end up getting even more dehydrated, and that can affect the bladder further as well. So this one here, It's always important, especially if you're getting this running to the toilet very, very frequently, if you're losing control of your bladder, if you're also finding that you're getting a dragging feeling, if you're getting a lot of pressure, especially when you sit down or when you move, then that can very often be an indication of a prolapse. So it's really important that you get this one checked out by your doctor first, just so that you know what's going on. But one of the best things for this particular problem, either a prolapse or a weak bladder, is something called Pilates. An experienced practitioner, and I'm so pleased because there's a number of practitioners have contacted me to say that they're now focusing on women's issues in the menopause. Their classes are full because so many women want to try and get on top of this problem of a weak bladder. So Pilates is one of the best ways in which to sort this. You will be shown very specific exercises that you can do in order to help to strengthen the pelvic floor girdle. And I have been told by numerous women, you know, it's not something that's going to happen night, but they have found that by keeping up with all these exercises, that their bladder control comes back, which is absolutely great. So still waiting for questions. Oh, here we are, they've come at last. Thank you. Hi, Andrea. Can you get insomnia during the perimenopause? Unfortunately, yes. Insomnia, either not being able to get to sleep or finding that you either keep waking up in the middle of the night or that you wake up really early and you can't get back to sleep, is one of the more common menopause symptoms. It's probably in the top 5. It's due to a number of factors. Falling estrogen or fluctuating estrogen levels can affect your ability to drop off to sleep, and it also affects your body's ability to stay in deep sleep. So you're in a situation where you may get to sleep, but because your sleep is much shallower, you will be woken up much more readily, either by your partner moving in bed, by noises outside, by traffic, by heat. You might find that just getting that little bit extra hot during the night will be enough to wake you up out of sleep. We know too that our emotional side during the menopause gets heightened. You start to worry more, you start to get more anxious. So instead of going to bed and trying to fall asleep and having a good night's sleep, you're lying awake worrying about everything that happened in the day. You're worrying about things that you forgot to do. You worry about things that you've said. You worry about what you've got to do tomorrow. So when you go to bed, when you're just at the point where you want to be in a relaxed state, your nervous system is actually going 10 to the dozen. What you can do here, there's a number of remedies. We have a sleep remedy called dormiazine, which is traditionally used in cases of anxiety just to help you to get off to sleep quicker and to give a slightly deeper sleep. So this is one that you can try. It works really quickly, and there's very few contraindications with other medication unless you're already on sleeping tablets. If it's your thoughts that are going 10 to the dozen, we have a lovely flower essence remedy called night essence. A few drops on the tongue before you go to bed, and whenever you wake up during the night and have problems getting back off to sleep, you can put a few drops on the tongue too. This is Mundo. Does HRT increase the risk of cancer? There's so many debates about this. There's so many women panic about it. The risk, as far as I'm aware, the risk is very small. However, this is something that you need to discuss with your doctor, because there can be other issues involved. Maybe to do with the fact that there's a history of breast cancer or other hormonally induced cancers in your family. It may well be that you have one of the serious breast cancer genes. It may be that you have high blood pressure or other health issues. So the thing here is that if you are thinking of going onto HRT, is to discuss everything well with your doctor. And this is one instance, for those of you who've been all along, I made a point of saying that you need to ask your doctor loads of questions. So if you want to go on HRT, if you're worried about the risk of cancer, then this is where you take a list of all the questions that you want to ask about HRT so that you can ask your doctor and they will be able to give you the best advice on that one. Joanne is asking, can the menopause cause you to put on weight? Yes and no. There's two things going on here. As we age, and unfortunately, you know, the menopause usually hits us around about middle age. As we age, our metabolism tends to slow down anyway. We're very often less active. You know, I spend a lot of my time in an office, and it's very difficult, you know, if I'm really involved in something, I forget to get up and run around the building twice. So we can become less active. If we are fatigued, if we are really tired by the time we get home from work, if we have joint aches and pains, we're not even going to be wanting to exercise. There's no incentive for us to do it, and very often it can make us feel even worse once we've done it. So we've got that side of things. So there's a very physical side of metabolism slowing down, being less active. And we know that falling estrogen can affect your thyroid function, so that can also decrease your metabolism too. What happens as well is that if we get a lot of anxiety, that puts our nervous system into flight or fight. And what happens then is that carbohydrates, if we eat a lot of carbohydrates, they will then end up being turned straight into fat, especially around this middle area. So you need to look at strategies in order to try and overcome this. If your periods are tailing off or they've stopped, if it's appropriate, you could look at our menopause support, as this is known to very gently raise and balance estrogen. You can look at doing very gentle exercises. If you have fatigue, if you have joint aches and pains, you can get exercises on YouTube now sitting in a chair, you know, 5 or 10 minutes, just to keep yourself moving that little bit easier as well. You can look at changing your diet. Many women with weight issues find that if they go on a low carb diet, this seems to have quite a beneficial effect on everything that's going on. If, however, you have put weight on really quickly, if you find that no matter what you do, you cannot lose the weight, this could be an indication that you have thyroid issues, and in which case, ask your doctor to test you for this just to rule it out. Jane, hi Jane, you're 43, you don't know what's going on, you're sweating from your head only, just your forehead. A couple of things here, especially if you are wearing 24-hour antiperspirant protection, and you don't tend to wash it off before you go to bed, it means that because your temperature regulation has gone wonky in the menopause, you can't sweat from under your arms, and the body gets into a panic because it can't cool itself down enough. And one of the things it will do is sweat from the head. So this is one instant to look into what kind of antiperspirants you're using. Maybe go with just a deodorant that will allow you to sweat, but the natural deodorants will kill off any odour. So that's one thing, and a lot of women have told me that that's made quite a lot of difference to their hot flushes and to their night sweats. The other thing that can happen, especially if you're getting profuse sweating, if you find that it's running down your face, is that could be an indication of low vitamin D. So again, if it's not an issue with your antiperspirants, ask your doctor to test you for low vitamin D. The problem here in the UK is that many of us are deficient. Just because very few foods contain vitamin D, we need to get it from the sun, and depending on where you live, there might not be a lot of sun available during the summer. And also we tend to put on suntan cream before we go out into the sun, and that may have an inhibitory action on vitamin D production in the skin. So Rani is saying, hi Rani, I have a dip in mood and more anxiety after my period, and it's different to usual. Is there anything you can do? She's in the perimenopause. Will this last long? Yes, this is the really common one here. Your anxiety and your mood can change. So although you might even be having regular periods, because your estrogen is dipping and fluctuating a lot more, that week, especially before your period, your estrogen levels can plummet, and that will trigger anxiety. You can become more moody, much more irritable, you can be much more impatient, you can cry a lot more, you can get much more upset and sensitive to what everyone else is saying. It's not a happy picture, especially that this last week you can be extremely miserable. What you can look at here is just to shore up your nervous system, things like your vitamin B complex. Magnesium is great for this, and especially if you get sugar cravings at the same time, very often they come together. It can be an indication that your magnesium is a little bit low. So this is one where magnesium, maybe about 150 milligram twice a day with food, can really help to boost and decrease your anxiety. Look at the water as well, because that sudden dip in estrogen can cause dehydration, and that will increase your anxiety as well. How long will the perimenopause last? This is one of these questions. It's how long is a piece of string? It's going to be different for everybody. For some women, the perimenopause goes by without a breeze, they hardly notice anything, suddenly their periods stop and that's it. For other women, the perimenopause can last maybe up to 3 to 4 years. It can be different symptoms. For some women, it's periods can come and go and miss and come back and then stop and miss again. For others, it's very much the mood side of things that can go on here. So unfortunately, this is one it's really difficult to answer. However, if you have older siblings, older sisters who've gone through the menopause, if you can speak to your mum or your aunties about it, or even your grandmother, then very often it tends to be hereditary here. So you might find that however long they went through the menopause, you might find that it will be roughly the same time for yourself as well. Victoria, hi Victoria, this is another memory one. You're saying your memory's been terrible, you're in the middle of a conversation and you can't think of some words and it's embarrassing. This is very much like the last one I was talking about, you just forget names. Yes, this and I know this was one of mine. You think you know exactly what you want to say and suddenly the word has completely disappeared from your vocabulary. It's extremely embarrassing, especially if you're in a work situation where maybe you're giving instructions, you're giving a talk, you're giving a presentation. The one thing that tends to happen here is we go into a panic. It's like, oh, I forgot what I was going to say. I can't remember that word. Oh no. That immediately makes things worse. The minute you go into panic mode, you will probably find that your heart will start to thump that little bit more. You might stop breathing. You might start to breathe very shallow, and that will make this worse. So it's about recognizing that this is going to happen and that you have to accept it when it does happen. What I found was it used to happen at work all the time, you know, as far as sort of herbs and all the things that we have to remember. There's quite a big vocabulary just to do with my job, and I'd just be in the middle of something and it's like, okay. So I just used to say to everybody, I'm really sorry, I'm having a black hole moment because my brain is completely empty. It will come back in a minute and I'm sure it'll be fine. And when you relax into it, maybe even just make a little joke, then that relaxes you and very often the word just pops back in. However, with this one, you can look at the concentration essence. We do a lovely flower essence. This is something that if you're going to be in a stressful situation where maybe you're giving a talk or something, and you just think you might panic, a few drops on the tongue before you go in, and very often that will help. So this is a really common one, and to be honest, most women at some point, either in the perimenopause or the menopause, is going to get this memory blip. The one good thing is it tends to be short-lived, which I was very thankful for. It's one of the phases, so you might find that you have it for 6 months and then it completely goes, and that's it. So Jane is talking about, I do have low vitamin D, but she can't mix it with and I can't say this, escitalopram. How else can I get your vitamin D? This is something maybe that you should speak to your doctor about. Have they offered you any other way that you can get your vitamin D? You could speak to the doctor to see whether it would be okay for you to get these special light boxes. I know some people use them a lot during the winter for SAD. Whether that would help enough, I don't know, but it might actually be worth asking. The other thing is just to try and get out in the sunlight for some point during the summer if you can. The problem here is that you do need to have bare skin. It's better not to have suntan cream on if you can, maybe for the first 10 to 15 minutes. The other thing you can do is you can look at vitamin D enriched foods. Again, speak to your doctor to see if that's okay. Things like your butters and margarines tend to have them. Mushrooms are also high in vitamin D, and dairy products as well. So these are some things that maybe you could look at. Obviously don't eat too many dairy products because they tend to be high in fat, but that's another way that you could maybe look at it. Raina, hi Raina. Is baggy skin a symptom of the menopause, as my skin is so thin? Definitely. Ladies, if you have any more questions, we'd love to hear from you, even if you have some really embarrassing ones. If you are suffering, you can guarantee that there are other ladies out there as well who would like maybe some answers for their embarrassing problems as well. So baggy skin, yes it is. I find them getting baggy around here, and your elbows and your knees start to go a little bit. Falling estrogen can affect the collagen in our skin, and collagen is a strengthening compound. It helps to keep our skin lovely and firm and in place. So when your estrogen falls, that can have a direct effect on your skin. So you're looking here, you can get collagen supplements. There are lots of really good ones on the market. So you can take that on a daily basis, and that can help to plump up your skin. Remember the water. This is really important, because if your skin is getting thinner and you're getting dehydrated, that's going to make more of an impact as well. Are you eating enough fat in your diet? Lifetime this week I posted my usual weekly video blog on skincare products and how you can look after your skin in the menopause, and one of the ladies actually commented on the fact that she had added a tablespoon of olive oil into her daily diet, and it had made an absolutely huge impact on the quality of her skin. So look at your diet here. If your diet is very low in fats, especially the healthy fats, then maybe just look at getting these back into your diet. You can look at things like your olive oil, you can look at your coconut oil as well. So these are nice ones to add into your daily diet that can help to plump up your skin as well. So we can also look at breast changes. This can be another embarrassing one if you're getting a lot of breast tenderness. Some women find that their breast size goes up in the menopause. They can become very hard, they can become very sore, your nipples can get extremely tender, and these are things that, you know, they might not seem particularly serious menopause symptoms, and a lot of women don't want to go to the doctor because of them, but they can really impact on your daily life, how comfortable you feel. and also what clothes you want to wear too. You know, if your breasts are really sore, sometimes, you know, some women say they don't even want to wear a bra because they feel so uncomfortable, and then obviously they don't want to go out of the house. So things like breast tenderness tends to be very common in the run-up to the perimenopause. Again, if your hormones are really fluctuating, if your estrogen is dropping suddenly before a period, very often that last week before a period, your breasts can get really sore. They can get very hard and very enlarged. It can be due to the hormones. It can also be due to dehydration at this time of the month. So again, if you're getting the breast hardness, then just check that you're drinking enough water on a daily basis. If it seems to be breast tenderness, some women find nettle tea helpful. Some women find a calcium and magnesium supplement helpful. Some women also find a zinc supplement can be very helpful too. So it might be a way of experimenting a little bit. And again, just watch at these times of the month that you've got the right size bra on, because if your breasts are enlarging a little bit and you have the wrong size bra on, especially if you wear underwired ones, these can actually cut into the circulation around the breast as well, and that can compound the problem. So this is a huge one. I've done a number of videos on different issues with the breast. So we have an absolute fabulous Vogel Talks Menopause playlist that has well over, I think now I'm doing about 170 videos, all on different aspects of the menopause. So if you want to look into a little bit more detail how to deal with the breast tenderness and soreness, you can check those out. But as with anything to do with the breast, if you are worried at all, please get this double checked by your doctor as well. Rani again, hi. I know I can't say when the menopause will end, but does it get better when it's over? For the majority of women, yes, it certainly does. This is, the menopause is a phase. We're going from one life, if you like, that's filled with hormones to another life where our hormone levels are a lot less. And it's just this phase in the middle, the menopause, which can really tax us both physically and mentally. It's all the hormonal flux going on. For most women, their bodies will cope. I mean, this is why it takes so long to get through the menopause, because our body it's fighting. It doesn't like being without hormones, and it's trying to keep itself in balance the whole time. And very often it's that change that's going on that causes a lot of the symptoms. So once the body learns to adapt to the changes that have gone on, you are then post-menopause and you can be absolutely fine. And I know for myself, I'm now through the menopause. I am fitter, I am healthier, I have got more joie de vivre, if you like. I'm much more risk-taking, I want more adventure. So there's nothing to stop you feeling as good, if not better, than you did before. It's just another life, but it's something you can make up yourself, if you like. Having said that, I know there are going to be those of you watching who are still going through it and are finding it a real struggle. For some women, the hormonal changes can really take it out of you. You might find that 6 years down the line, you are still having problems. This is when it's a good idea to go and see your doctor, especially with those tests, because very often if you are still struggling with the menopause well after your periods are finished, sometimes it can be due to other health issues. It can be due to things like your low thyroid. Even if you haven't had periods for years, especially if you're vegetarian or vegan, you can end up with low iron, and that can cause a huge raft of symptoms that are practically identical to menopause ones here. So I think the best thing to do is when you're in the perimenopause and in the first part of the menopause, if you're struggling, is to just say to yourself, yes, there is an end to it. And many women find that, you know, that there comes a point when you think, oh, you know, my symptoms are going, I'm not feeling quite so bad, I'm starting to sleep better. And that's an indication usually that you're approaching the end of it. as with all things, the more you look after, the better yourself, the better the diet you have, the more you try and get rest and relaxation, the more tools you're giving your body to cope with everything that's going on. So this is a really important time for self-care and putting yourself first as well. Stacey, hi Stacey, she's saying, my hair has thinned by 75%. She is trying minoxidil, say that, but truthfully she gets to apply it daily. Do supplements really work? And hot flushes and sweating in her head is making it difficult to wear wigs. This is one here. I would assume if you have been to the doctor that you have been tested for low thyroid function and also low vitamin D and also low iron, because all of these can affect your hair growth. If you haven't, then please do go and ask the doctor to check for these ones. In this situation, if it's serious hair loss, then your average over-the-counter supplement is probably not going to make a great deal of difference. Might be worth trying. You would look at ones that have things like MSM in them, that have the B vitamins in them, that also have things like calcium and magnesium in them, and possibly things like some form of collagen as well. So you need quite a comprehensive one to cover everything that may be associated with hair growth. The other thing that you could look at here would be acupuncture. This can sometimes be very effective, so it's worth checking to see if you can find an acupuncture practitioner who specialises in women's health, and they may be able to do something here. Again, the sweating on the head, you can look at the herb sage. This is a super remedy. There's loads of research on it. We do a licensed version which is traditionally for excessive sweating and hot flushes in the menopause. Sage usually works very quickly at helping to reduce hot flushes and night sweats. So, you know, sometimes even trying for a couple of weeks, you may find that you start to get some benefit there as well. Janet's asking, what was the name of the product I suggested for anxiety? That would probably have been one of the flower essences. If it's nighttime, you would look at Night Essence or the Dormiazan for sleep. If it's daytime, we have a lovely remedy called Relaxation Essence for anxiety. Other supplements for anxiety would be things like your magnesium, your B-vits. If the anxiety is quite severe, then you can look at herbs such as maca, rhodiola, or ashwagandha can sometimes help too. If it's more low mood, then the herb hypericum is a nice one to try, although it tends to take maybe four weeks or so to kick in. You need to watch with that one because it's contraindicated with prescribed medication. So some of the other gentler herbs would be fine if you're on prescribed medication. Tammy's saying she used pregnenolone for 6 months, her hair fell out and she gains more weight. What hormone should I be taking? And she loves my work. Thank you for your nice, kind comment. Tammy, this is one where I would really need to know how old you are, what symptoms you're having at the moment, just to see where you are in the grand scheme of things, to find out what you might need at this particular point. You can either give me a quick overview here, or if you want to do it more in depth, which is better for me because then I get more information, you can email me, eileen@bioforce.co.uk, and I can go through things with you there. Oh, Mundo again, hi. Is it normal to get more sebaceous cysts during the perimenopause? Yes, this is something that can happen. You can, with the skin changing, if you're getting a lot of sweating, if you're having problems with your digestion. We know also that the liver can be affected in the menopause too. And if the liver is affected, then the liver's cleansing and detoxing ability of the body can be less effective, and for some women this can result in cysts. And the problem is you can get these cysts anywhere. Some women find they get breast cysts, some women find they get cysts in the vagina, others get things like polycystic ovaries syndrome. You can get them in hair follicles, and some women find they get them under the arms and in the areas where the lymph glands are situated. So this is one, to be honest, if you're getting these really regularly, if they are not clearing up, if they're getting to the point where you're having to go to the doctor to get them drained, it's far better to see a complementary practitioner. So you would be looking at someone either such as a nutritional therapist who can look at your diet, who can look at your elimination, and they can formulate a personalised plan for you, or maybe even check with acupuncture as well. Unfortunately, you know, the menopause can throw up all sorts of things, and it's not necessarily the menopause itself that's doing it, but it's the fact that the menopause is putting extra pressure on all the systems in our bodies, and sometimes it's the systems that just crash with all the extra pressure that's being put on them. So some symptoms you can think, how on earth can that be related to the menopause? But when we look into it that little bit deeper, we can end up seeing a link between everything that's going on. Joanna, hi. Joanna, is irrational feelings and thoughts because of estrogen depletion? Yes, it's a really common one. It's a horrible one too, because you can end up getting into such a state of anxiety, of fear, and for some women, unfortunately, it can lead to states of paranoia as well. You know, we get some women who feel that everybody's down on them, that they're being persecuted and picked on at work. So this is a really horrible one. It's to do with estrogen. One of the things estrogen does when we have plenty of it, it has a check on our most irrational and deep bedded primal fears. So when our estrogen starts to decrease, it's these kind of primal, I call them the reptilian fears, is very much to do with survival. So these fears then manifest themselves into our daily life and can cause all sorts of problems. So this is a really horrible one. If it's falling estrogen that's doing it, then certainly look at your phytoestrogens such as our menopause support or black cohosh if they're appropriate. You need to really shore up your nervous system, so high levels of magnesium, B-vits and zinc, and go for some of the kind of stronger nervous system support remedies such as maca and rhodiola and ashwagandha. Look at these ones. If you find trying these that you're still having serious issues, please go to the doctor with this one. You know, I know the majority of women, especially the ones that contact us, you want to go through the menopause as naturally as you can, and you would see going on HRT almost as a failure. But for some women, this is absolutely necessary. And if your mood gets to the point where it's really affecting your daily life, if it's affecting your work, if it's affecting your relationships, then please speak to your doctor about this one. You might need just a little bit of support short term until your hormones start to rebalance themselves. Okay, Alison. Hi, Alison. I'm perimenopausal. You feel completely wrecked all the time. You ache all over, you don't sleep, and you feel tired all the time. Any advice? Again, this is one of the really common ones. A number of women who come to me with this. And again, most women at some point in the menopause are going to get this phase of fatigue. All that's really happening here is that with all the hormonal changes going on, remember I said your body's trying desperately hard to stable itself, that takes a huge amount of energy, which means there's not enough left over for most of your daily life. But what happens is, as women, do we give in? Do we say, right, I'm going to rest for the rest of the menopause, which, to be honest, we should be doing. We plough on, we get up, we go to work, we're doing everything that we did before. but at the same time our body's got all this extra work to do too. And the fatigue is basically just your body's way of saying, help me, I can't cope. So it does need to be addressed, because if you keep running on empty, you can end up seriously crashing. You can look at remedies to help to support the nervous system. Just make sure you're eating really, really well. So this, you know, you need good nutrition during the menopause to provide you with the things that your body needs for all the energy it's going to use up. So make sure you're eating really well. A good vitamin and mineral supplement can be really helpful here. 30 minutes me time, this is absolutely vital in your day. I know a lot of women say, I don't have time. You have to make time for this, because that 30 minutes, if you rest and do proper relaxation, and I was just reading an article just a couple of days ago where, again, another university in America has found that 30 minutes of mindfulness can decrease your menopause symptoms quite considerably in a very short space of time. So that 30 minutes me time that you give yourself, honestly, it's worth its weight in gold. You'll also be less fatigued, which means that if you've got partners, if you've got family, if you've got friends, it means that you've got more energy to spend time with them as well. With the fatigue, it can also be caused by low thyroid, low iron, low vitamin D. So if you're getting it on a daily basis, just pop down to the doctor, download our little chart, which you can tick off all your symptoms that you're having, take down to the doctor. It can make it a lot easier. Just get these things checked out to rule them out. Dehydration and low blood sugars will all cause fatigue as well. So make sure you're drinking plenty of water, and that you're eating little and often too. Really important. Antoine, hi. She's struggling with the weight and she's smelly down below. Okie dokie. The weight one we've covered already previously. Look at your diet, make sure you maybe go on a low carb diet, and thyroid issues as well need to be looked at too. This vagina smell, this is another of the really common ones, and it's all to do with the friendly bacteria in the vagina changing, and that can let other bacteria in that end up causing a different vaginal smell. The thing with this one, do get it checked out by the doctor, especially if you're getting a coloured discharge, or the discharge is different to your normal one, because that could indicate that you might have a vaginal infection such as thrush, and obviously you need to get that treated. But one of the best things for this is a vaginal probiotic. If you're here in the UK, there's a company called Optibac that do one especially for conditions such as this. You'll get it in most health food shops and pharmacies. And remember to drink plenty of water, because dehydration can be an issue. Also remember too about allowing plenty of air to get to the area. There are changes going on in the whole vagina area, so just make sure that you're not wearing really tight tights and jeans, and also you're wearing cotton underwear as well, because that will all help your friendly bacteria too. Okay, ladies, the hour is just about up. I've got time for one more question. If I didn't get a chance to answer yours, I'm really sorry, but you are more than welcome to email me, and I will answer you as soon as I can. My email address is eileen@bioforce.co.uk. Also look out for my weekly menopause video blogs that come out every Monday. Look at our A Vogel menopause playlist as well. So one last question, which for Jacqueline. Jacqueline says that you have used almost all our products that I've recommended, but still can't find anything to help with my sex drive, and you feel so lonely as your partner tries to understand. It's a really difficult one, and as you know, you can see if you're used to a very active sex life, it's that physical closeness that you end up losing too. If you've tried the normal remedies and they don't work, it may mean you need to go on to slightly stronger ones. Check that you know, if you're periods have completely stopped, you might find that if you haven't already tried the menopause support, that might raise your estrogen levels back up a little bit. There are other supplements that you can get on the market. There's a company called Pharma Nord that do a supplement especially for women for increasing libido, so certainly maybe have a Google of that one. The other thing is maybe to check with acupuncture. Also look at what are you doing in your daily life. Are you getting the fatigue? So look at everything that's going on, not just the fact that your libido is gone. Sometimes just changing your lifestyle a little bit can give your body that little bit of free space. The other thing that some women tell me they find really helpful is that when your libido is gone, your partner is maybe indicating that they're in the mood, it puts yourself under so much pressure. And if you're already tired, that there can be a very swift emotional block that's actually causing the physical symptoms. So the emotional thought of, oh, I have to perform. Some women tell me that they find going right back to basics, going back to when they first courted their partner. It sounds a really old-fashioned word, courting. And they arrange date night. So this is something that they will say on a Sunday, let's have a date night on Friday night. We're going to go out for a meal, maybe have a little drink. We're going to go to the pictures. So what's happening here is that anticipation is coming in instead of negativity, and you've got that to build up for the whole of the week. And some women tell me they love going back to basics because it brings back the romance, and it also means that they are making time rather than just trying to put in some time. So thank you all ladies for joining me today. If you haven't subscribed already, please subscribe to this channel and hit the bell icon to be notified of my new videos coming up, and also live chat. Hopefully live chats, I will see you at the beginning of next month. So until then, do take care, and remember, you're more than welcome to contact me if you have any queries. See you later. Bye.